The devices are latex-free and made of a thermoplastic elastomer. All the devices, at least in my clinical practice, I always clean them with whatever I'm cleaning the patient with. So if I'm at the bedside, I use whatever wound cleanser I'm using on the wound to wash the device, and then I just set it to the side and let it dry. If I'm in the operating suite, I use whatever the solution is that they're prepping the patient with, and I just have them prep the device and then we set it to the side. And so that's how we utilize the devices, but they are not sterile. They certainly are single-use only, and I always think of it like this. If I'm doing a good job in wound care, my wound should be healing and changing, every day that I'm taking care of that fistula patient. So you really need to tailor the devices for the changing wound bed. A question that comes to me frequently is, how do I make sure I have a good seal? Some of the things that I like to use is a barrier ring at the interface between the wound bed and the device. Sometimes I'll use a little bit of stoma paste on the interior of the device just to make sure that those little micro cracks are sealed as well. When managing a fistula, pouching is extremely important, and I would like to say that probably the best thing I've ever done is failed as much as I have, because I realized that a urostomy pouch with the bevels that are inside of it are really made for urine, and when I would use them on a fistula patient, they would get all plugged and they couldn't get the effluent out of the bag and it would blow off. So that's not a good option. Most of ostomy bags are a pretty good option, but because of the fact that small bowel fistulas have such a high volume of effluent, because in 24 hours the small bowel makes 9 liters of stool, whether the patient's eating or not. And so 9 liters is a lot to put into a pouch. And so I really recommend high output pouches with a secondary containment system, because that way you know that when you put together your fistula dressing, that the pouch won't overfill and soil your entire dressing. So I recommend high output, flexible front plates. Those are the 2 big things when you're using a fistula isolation device and a dressing. Dressing changes need to be a well-oiled machine. And so we literally put together an order set at our facility where 90 minutes before the dressing gets changed, we do an oral anti-anxiety medication. Because much like a burn patient that has the repetitive dressing changes that are painful, that's very similar for fistula patients. So we have to treat them very much like burns. And so we give them anti-anxiety medication 90 minutes before, an hour before. We take away their food and drink, because obviously that's directly related to a spontaneous eruption of the fistula, which can stop your whole dressing and you'll have to start over. We give them pain medication if they need that, and then we collect all the parts, because putting together a fistula dressing isn't just 1 or 2 things. You need several different things, including suction and a second pair of hands. And so I think to make that easier, we actually developed a checklist and an order set so that we would have not only the equipment that we need, we'd have the patient in the right place, both emotionally and physically, and also all the different pieces of equipment to put together these complicated dressings, because we have to manage the wound, isolate the fistula, and then use ostomy products to pouch the effluent. So it's kind of a hybrid of multiple different things, and you really need to have it all right then and there, because unlike most wounds, you're kind of under a time, like a time crunch, because the fistulas will become active all of a sudden, and then you have to just wait it out. And so I think that making sure you have everything you need and the people in place and the patient in the right spot is imperative to putting together a good fistula dressing. The dressing checklist that I was speaking about is available to anyone and to access it, you can just go to the KCI website or to the Fistula Solution website, and you can access the dressing checklist and implement that in your own facility. A question that I get frequently is that the wound dressing is okay, but there's leaking between the top of the device and the pouching system that you put on the outside. And if there's any little wrinkles or bumps around that, you can have leaking. I just take a barrier ring and I put the barrier ring down, and so you have an interface between the top of the device, a barrier ring, and then the pouching system.